Hi, welcome to another episode of Veterans Health Today. Here is where you learn about the services, programs, and benefits offered at the Dayton VA Medical Center. I'm your host, Public Affairs Officer Rhonda Moore. Dayton is home to not only one of the first VA campuses, but also a state-of-the-art medical facility offering top-quality care to those veterans in need. Our heritage dates to President Abraham Lincoln, who signed legislation creating our campus and what's now the modern VA. Our mission is to fulfill his promise to care for those who served in our nation's military and for their families, caregivers, and survivors through the employment of modern medical services, many of which are geared to the special needs of our veterans. It's an alternative way of living for some veterans. It's called the Medical Foster Home Program, MFH. It offers veterans long-term care in a home-like setting. And joining me now to talk about it is Laura Metz, and she is a social worker with the Dayton VA. Hi, Laura. Thank you for being here.
Hi. Thank you so much for having me.
Tell me a little bit about yourself. How long have you been at the Dayton VA?
I have been with the Dayton VA about 2.5 years, and prior to that, I was a social worker with the Columbus VA, and I also was a social work intern at the Lexington VA in Kentucky.
And how long have you been with the MFH program?
I've been in the role of the Medical Foster Home Coordinator for about 1.5 years.
All right, and explain what it is for those out there who don't know.
Yeah, so Medical Foster Home is an alternative choice for long-term care placement for veterans who aren't able to live independently any longer, and they may prefer a home family type of setting rather than a nursing home or assisted living type of setting. So what we do is we pair certified caregivers with veterans in need of long-term care, and the veteran then transitions into the medical foster home to live with the caregiver in their home. And then the caregiver provides 24-hour care, hands-on care, 24-hour supervision, assistance with medication management, managing appointments, transportation, meals, recreational activities, things like that.
So it's an alternative to a nursing home.
It is, yes. When veterans are faced with the choice of, sometimes they're at a crossroads and they have to choose, am I going to move into a nursing home or an assisted living? This is a different choice. They may not have to move into an institution or that type of setting and be in a facility. They can actually stay with a family and become part of a family in that setting instead.
Do you know how many veterans with the Dayton VA are in this program?
We currently have 5 veterans in the program. We're slated to move another veteran into the program, so that will put us at 6. And we do have availability for 3 more veterans at this time.
Now, who can get into the program?
As far as the veteran?
Yes.
Well, they do have to be eligible for VA health care, and they have to meet level of care. So we're looking for nursing home level of care or assisted living level of care. And what that means is that they need assistance with activities of daily living, such as showering, dressing, grooming, or sometimes they have cognitive issues and that's their barrier, and so they need more support in that way with medication management, meal preparation, and any veteran that's really just struggling to live independently any longer.
Is there any age requirement, like how young, how old?
No, not at all. Unfortunately, we don't have any OEF, OIF veterans in our program, but there are veterans of that age group nationwide. Our youngest veteran is in his mid-50s, and so it's typically Vietnam era or Korean era wartime is what we have in our program.
And is there any kind of stipulation as far as the veteran's health?
No, we really don't rule out any, we don't take this type of illness. We don't have anything like that. What we do is we pair the veteran's needs up with a caregiver that can meet those needs. So, for example, if a veteran's wheelchair bound, I'm going to look for a home that's handicap accessible and pair him with that home that's going to better be able to meet his needs.
You mentioned that you'll have 6, and then you said you have a slot for 3 more. Why is there a limit on how many you can have in the program?
So each home is allowed to care for up to 3 veterans at a time. And right now I have 3 homes, and so I have 2 private bedrooms available in the home in Dayton, and I have 1 private bedroom available in the home in Richmond, Indiana.
But if you had more people who were caregivers, then you can offer it to more veterans.
Exactly, and that's what we're hoping for.
So what does a veteran have to do if they're interested in getting into one of these homes?
They can request their primary care team to put in a consult for medical foster home, or the veteran can just contact me directly and I can do a screening that way to see if they meet our level of care.
And go ahead and say how they can contact you.
They can contact me by phone at 937-268-6511, extension 1130.
And what about caregivers? Is there a requirement for a caregiver?
Our caregivers do have to have some type of caregiving experience, whether it's informal or formal. Most commonly, we do have former nurses, LPNs, STNAs, or home health aides that are really interested in becoming caregivers. They have to live in their home and own or rent the home. They have to have a health certificate from their physician saying they're physically able to provide care in the medical foster home. And they have to pass a background check and be CPR certified and be able to communicate with our home-based primary care team about the veteran's needs.
So if they're not CPR certified, will you guys help them with that, or what do they have to do?
They have to do that on their own to get CPR certified because we don't offer that at the VA for caregivers at this time.
Are you finding a lot of people are interested in being caregivers, or what are you finding?
I see people are interested until they kind of see how much it really involves. It is 24-hour care. So if you have to leave or you get sick, you have to have a designated relief caregiver to be there to take care of the veteran if you're unable to. So it's a really, really huge commitment, one that's very worthwhile, but I see that can kind of turn people away.
So you make sure that they have someone else as an alternative before they're able to have someone brought into their home, before they can have a veteran in their home.
Absolutely. Yes, they have to have a designated relief caregiver, at least one. It's better to have more.
Mm-hmm. Speaking about the home, what about safety? Is there any kind of safety requirements that you have to have?
Yes, the home has to initially be inspected by our fire and safety chief, along with myself, the coordinator, dietitian, a nurse, and physical therapy before the home can even be approved. And then every year, the home has to pass annual inspections by that same multidisciplinary team. There's also the home-based primary care presence in the home. So we're having doctors, nurse practitioners, nurses, dietitians go out to the home regularly. So there's also a medical presence in the home. And then the coordinator, I do unscheduled drop-in home visits at least once a month just to make sure everyone's okay.
All right, good. And is there any limit on how many veterans a caregiver can have in their home?
We do limit it to 3 veterans per caregiver or 3 residents per caregiver, just to keep the ratio low and so the veteran's getting more one-on-one time, quicker response to needs, and just better care overall.
Now, is this something that's permanent? Once they say, I want this veteran to come live with me, is this something that can be from one period of time to another, or is this a permanent situation?
It can be both, actually. Most veterans move into the program thinking it's going to be their long-term placement. They're going to be there the rest of their lives. Some veterans maybe have a different goal they want to meet while in medical foster home that they couldn't meet in their other living situation. So, for example, I have a veteran that really wanted to work on his rehab and to get to the point where he could maybe live on his own again. And so he's been in our program about a year now, and he's gotten a lot stronger, a lot more independent, not quite where he needs to be yet. So it can be both. It can be long-term forever, or it can be more of that short-term, maybe like 6 months to a year.
And how does the veteran pay for this? Or does the veteran pay for it, or the VA?
Mm-hmm. A little bit of both, actually. So historically, the veteran pays the caregiver directly from their own personal funds. We do have aid and attendance that can offset the cost of medical foster home. And that aid and attendance benefit is something that I help the veteran apply for. I submit the paperwork and have it expedited for it to be approved quicker. And aid in attendance is around $2,200 a month at this point. But what's really big news is that legislation and President Biden approved the Cleland-Dole Act in December. And what that is making medical foster home one of the VA paid long-term care options for highly service-connected veterans. And those veterans are 70% service-connected or more. And so historically it was the VA would pay for a community nursing home for those veterans. But now medical foster home is going to be a different choice. They don't have to go to a community nursing home. They could go to medical foster home. They're working very hard at National to be able to implement this and how it's going to look. So it hasn't quite started yet, but we're expecting a lot of growth and a huge influx of veterans that would prefer medical foster home first over a nursing home. Hence why we're really looking for caregivers to get prepared for this.
Right. What does the caregiver get paid?
Our average cost nationally is around $2,500 to $3,500 a month, depending on level of care and the veteran's ability to pay. The coordinator, I help negotiate what's comfortable for the veteran and what's competitive for the caregiver in the role of providing 24-hour care a day. And so it'll be really exciting to have the Cleland-Dole Act start and what that's going to look like for the program.
Does the caregiver have to have like a certain type of vehicle or anything like that, since they may have to transport the veteran back and forth to appointments or whatever?
So our caregivers usually use transportation from the VA to transport the veteran to appointments. And then there's a lot of resources in the community with the county veteran service agencies and other senior resources that do transportation for wheelchair van or non-medical appointments.
Expand a little bit more about what you were saying about how you want the program to expand here in Dayton.
Well, we just opened a new home this spring, and it's I believe it's one of the first homes to be in central Dayton. And so that is a really big impact for our program to be able to serve veterans in the Dayton area. And with the expansion of the Cleland-Dole Act, we are really actively looking for caregivers to join us and want to take care of veterans in preparation for the influx of veterans that prefer medical foster home. I think that we're small. We're a small program, but we're big on impact. And I think that moving forward with this growth, our impact is only going to be bigger.
So say again what someone should do if they're interested in being a caregiver, so we can expand this program.
Yeah, contact me directly by phone or by email is the best way, and then I can assist with doing a screening and give an application and start the process.
And give out that phone number again and your email.
It's 937-268-6511, extension 1130. And my email is laura.metz, laura.metz@va.gov.
Laura, is there anything else you want to say to those out there watching who may be interested in the program?
This program is amazing. I truly believe in it, and a lot of people who hear about it believe in it. And we have the power to change lives and make a really, really big impact for veterans and give back to them during the aging process. And that's the VA's commitment to caring for our elderly, aging, medically fragile veterans. And I think this program is a huge reflection of that.
And I think most people probably want to be in a home or home-like setting, even if not in their own home, prefer to live that way. So I think this program is really great in helping them live that way.
Absolutely.
Yeah. Thank you, Laura. We
Thank
appreciate
you.
you being here. Thank you for sharing all that information about the program. We appreciate it. And when we come back, we're going to talk to a veteran and caregivers involved in the program. But first, this public service announcement.
America's veterans have sacrificed so much to protect our freedoms. And we need to show our gratitude. But how? Well, we can volunteer at a VA medical center or outpatient clinic, at a VA community living center, a Veterans Benefits Office, or at one of our national cemeteries. We can also contribute online to help support veterans programs. Let's show our nation's heroes just how much we care. Volunteer or donate today to thank America's veterans.
We are back and talking about the VA Medical Foster Home Program. And joining me now is Army veteran Jim Durham and his caregiver, Glenda Ford. So Jim, tell me what made you want to get into the program.
the lack of success that I was having. When I found out that there was an option, man, I ran to it. And if it wasn't for that cutie over there, which is my granddaughter, I wouldn't be in it today.
And so how did you find out about it?
An OT that was coming in told me about it, and it just brightened up my whole life.
When you say OT, what do you mean?
Occupational therapist, that I was coming into my home. Everything just changed, and I'm at home.
All right, so Glenda, what made you want to become a caregiver?
I've been a caregiver most of my life, and I helped my mom raise my siblings when my father passed away, and then I became a registered nurse, and I did that for about 27 years, and about 5 years into till I got ready for retirement, I decided that I wanted to do something different, to have it look different than what I was seeing. So I had wanted to open up my own home and have people come in so that I could take care of them. And it happened a little bit before I was prepared for it. My mom got cancer, but I went ahead and retired, and then I took care of my mom and started getting ready for the program, getting my home ready, and found out about the program. I believe it was from someone at an Alzheimer's walk, and got started, and the coordinator helped me through the process and made it really easy for me to get everything prepared, and that's kind of how it started.
And what year was this?
It's been about 7 years ago.
Okay. And so Jim was the first person that you got? Or?
No, my first person was actually a hospice patient, and he was discharged from hospice into my home, and very, very nice gentleman. He was a Korean War veteran, and we were able to take him to do quite a few things while he was living, and we took him on like a weekend train ride, and we were able to take him to his family reunion and to his place of birth. And we were also able to help him get his 2 Bronze Stars medals through the VA coordinator's help, and he was able to pass those on to his children.
Oh, that's nice.
Right.
So when did Jim come to your home?
About a year ago.
Okay, so relatively new.
Fairly new, but
Just a little over a year.
Okay.
making lots of progress.
Okay, so how are things going?
Well, I love the family, and the family includes not only the veterans, but the owners of the home. They made me feel completely at home, and I'm very blessed to have that. Okay, so, and the reasoning is because of my stubborn attitude. So I can tell you that I wouldn't be where I am today without them.
So it's changed your life.
Yes. I wanted to die, and now I don't.
And why did you want to die?
Because if I couldn't walk, I didn't want to be here.
So talk about that progress then, how it got to the point where you're at.
I know it's going to be a long haul, and I'm quite old. So I'm willing to take the time, and as long as the VA continues to support me, I'm going to be a happy man. And I know it's not going to happen overnight, but I'm slowly getting there. And I'm very appreciative of what everybody's doing. I know that the equipment that they're buying for me is not cheap, so how would you not be appreciative? You know, I think the VA has done a wonderful job, and I can't speak for any other caregiver because this is the only one I've had within the program. But I know that she is bullheaded, stubborn, rigid, and I couldn't do it without that.
That's what you needed? And so Glenda, just talk a little bit about the relationship, and you guys are mentioning family, so who else is all in the home?
My husband and I live there. When it first started, my younger son was there, but he's grown and out on his own now. But my older adult children, one of the things that I always tell people when they're getting ready to come into my home is my family and my children are extremely supportive,
Yes.
and they make it so that the veteran feels extremely at home. They can ask my children to do anything for them, and it's going to be done with grace and kindness, and never to make them feel like they're putting them out.
They have
And
been so respectful.
they have. I cannot say enough about the support that I get from them, and it makes it so much easier for the veteran coming in. You do go through a process when a new veteran comes in. They go through the process, and so do I. You have to learn that resident, and you know, it's at first they call it the honeymoon period, and it is very true. If you were to come into my home now versus 2 years from now or 2 months from now, we would have a different relationship, and we would be more casual and more comfortable with each other. And as time goes on, you see that happening. And with my veterans, I have 2 in my home right now, actually 3, and they are good companions for each other. With Jim, when we first started out, my husband and I, we went to see him at his home, and we asked him what his goals were. And his goals were to walk again and to be able to live out on his own. And when I first started out my career, I actually worked in a rehab facility, and that's what we did. We prepared people to go back out on their own. So it was like a joy to my heart to be able to say, okay, I can do this again. And with him and with his attitude of really wanting to put that effort into it, I honestly believe that we could do it. And it's not a dream for him anymore, it's a reality. He's actually walking now. And he's put the effort into it. I have a great aide who comes in, works with him to do these exercises of 2.5 hours a day. She puts into it. And between her and Jim and myself, we are making his dream very possible.
And what's good about it too, for people out there watching to know, is that you can still have your family there as well when you bring in a veteran. It's not like it's only you and that veteran living in the house.
Right.
Well, we also associate as veterans. You know, we're very close. We jump back in the foxhole together. So it's really kind of neat.
Glenda, what would you say are some of the challenges to being a part of the program?
You are a 24-hour caregiver, and you wear many, many, many hats. You're the dishwasher, the cook, the laundryist, but the rewards that come from it are so much more. And for someone who wants to be at home, who loves being at home, being with their family, being able to give the kind of care that we believe in, it's the perfect job. And I could not express to people how good this has been for my family and my life. You know, I've never dreamed that I would be a successful businesswoman. It was just not in something that I even considered. But through this program, I can do that and still be the mom, the wife, the caregiver that I want to be.
And you say there's 3 in your home right now, so that seems like a challenge.
She also has 2 aides.
Yeah, it can be, you get organized, and with each new patient that comes in, the dynamics change a little bit, but it's very easy to do. And you, just like any other, when your kids were younger, you had to, you know, there's a bedtime, you know, these guys go to bed whenever they feel like it, but you just learn their behaviors and what they want and what they need from you. And it becomes very easy. They're all very individual people, and yeah, you just learn their needs, and it becomes easy.
Do they like go out on their own, come back home when they feel like it, that kind of thing?
Some of them do. Like Jim,
not you.
No.
Like he's allowed to go to the VA to his medical appointments by himself. But when we go out, we take them with us.
Yeah, I just don't disappear.
No, he doesn't disappear. Thank goodness. But I mean, I don't believe in just staying home. They come to my house to live. It's not just a place you go to just sit. That's not what we do. We want to make things fun for them. We go out to dinner. We take them places. We've taken them on many vacations.
And I know there's a cost to that.
But through the program, it makes it very affordable for the caregiver and for the resident.
So it really is like a family.
Right.
Yes.
Yeah. So Jim, what would you say to other veterans who are maybe considering, or maybe this is the first time they've heard about this program? What would you say to them?
So I think the most important thing is getting the word out that there is a program, and check into it. Make the phone call. Don't be afraid. These are good people. I mean, Laura has done more for me than anybody at the VA ever. So that's the kind of people that they're hiring down there now. I have to ingest a little statement.
Okay.
I've been to 4 VAs. So when I got sick, I said to myself, I got to get back here to Dayton somehow, because I knew that they would take care of me. And I was right.
Well, that's wonderful to hear. Thank you. Thank you so much for saying that. Linda, do you recommend this to other caregivers?
I am constantly looking for caregivers who I feel would be exceptional to be able to open up their homes and stuff. I believe in this program. There's no reason why our veterans should ever not be able to have the care that they deserve. They've served our country, they've sacrificed. There's no reason why they should not have a comfortable, safe, loving environment that's good for them and that they feel comfortable in. I'm a very strong believer in this program.
Well, thank you, Glenda and Jim. Thank you so much for sharing your life and telling us about the program and what you get out of it and how you feel about it. We really appreciate it.
Thank you for doing what you're doing. Thank you for having us here.
All right, we are taking another break, and when we come back, hear why another caregiver signed up for the Medical Foster Home Program. We'll be right back after this message.
It was a different time when I served. I felt confident in the work I did.
But when I came home, I felt lost.
When I retired and had all this time on my hands, lots of bad memories came back.
Whatever you're dealing with, there's someone to help.
If you're going through a rough time or having suicidal thoughts, call the Veterans Crisis Line.
We are back talking about the Medical Foster Home Program, and joining me now is Sandy Clements. And Sandy, how long have you been a caregiver, and what made you join the program?
Well, I've been a caregiver approximately at least 25 years. I've been with the VA approximately 7 years.
With the program?
Yes, with the Medical Foster Home.
And what made you want to get involved?
Well, my mother got Alzheimer's, and I took care of Mother for 5 years, and I decided that since when Mother passed that I wanted to continue taking care of people because that's what my heart felt that I needed to do.
That's who you are.
Yes.
How many veterans do you take care of?
Right now we have 2 veterans.
So what kind of things do you guys do during the day?
We exercise. I'm trying to encourage them to go on bike rides with my husband, and sometimes we go on walks.
So with veterans in the program, you're actually out doing things with them?
Yes.
Like a regular family?
Yes, we do all kinds of things together. We may go see a movie, or if they want to stay home, we stay home and watch a movie that they want to watch together. And we just find a lot of interests that we all want to do together.
And what are their ages, your veterans?
We have one veteran that's in his mid-50s, and we have another veteran that's in his early 70s.
Okay. Just what do you get out of being this caregiver and doing for these veterans?
The thing I love the most is how appreciative they are when you're providing care for them.
And what would you say to someone who's watching today and maybe they're thinking about becoming a caregiver?
I think it's the most rewarding thing that you can possibly do is become a caregiver. You'll have a friend for life.
Sandy, thank you so much for being a caregiver, being a part of the program. We appreciate you for taking care of our veterans, and we appreciate everyone else in the program for doing the same.
Thank you so much. I appreciate you too.
Thank you. And that is another edition of Veterans Health Today. Veterans, if you want information about enrolling at the Dayton VA, you're encouraged to call the Medical Center at 937-268-6511, extension 2035. Or you can call one of our 5 community-based outpatient clinics or CBOCs, and you see the numbers there on your screen. Thank you so much for watching this program, and veterans, thank you for serving a grateful nation. We'll see you next time.